What up, Z-Pack?
Z-Pack is back.
So we're like, what? Call your cousin.
Yes, we are using Indian accents this time. That's I'm telling you.
Your cousin will do it. He'll put it up.
Today we're going to find out just exactly how ignorant medical doctors are when it comes to diet, nutrition, and health. And I want to tell you one thing. Medicine does not lead to health. They are in opposite directions. Dr. Bob, we're back here with ZDOGGMD, and now he's got a friend with him, Dr. Singh, a colleague, Dr. Ron Sinha, S-I-N-A-H. We have two medical doctors, but I don't see any stethoscopes, so, all right, mine'll be right here. I see one of those come on. You know what's going to happen. I think Z-Dog's trying to show everybody that he really was right in his comments on that documentary, What the Health, when really he was about as far off as he could be. And he's trying to say still, hey, you know, I was right and they just aren't looking at the numbers right and the vegan diet isn't right. You're going to find out this other doctor saying he's going to really start totally agreeing with me here very shortly. And he might end up like another Dr. Sheila Carr. She ended up missing. I think you remember that one where she just
learned in medical training. So interestingly, we started seeing that pattern. And what I started doing too was I started following my own numbers in the same way, following the same advice. And incidentally, I ended up developing metabolic syndrome, which is a real risk factor for heart disease.
So you're following traditional medical advice. I mean, this is an honest doctor here. This guy is going to disappear from the planet. You followed traditional medical advice and you developed all the problems you thought you were curing, okay? This is an honest guy. I like him.
And I'm following the same advice, and I'm actually getting sicker. So at that point, I'm like, okay, traditional training is really not doing the trick.
No, when you keep getting sicker and sicker, it's not doing the trick.
I mean, how many hours of nutrition training did you get in medical school or medical training?
That's how many.
Yeah,
it was how to read the recommended daily allowances on the back.
It was, yeah.
Well, there's some credentials. In medical school, they don't teach you anything about diet and nutrition.
Yeah.
It was learning the food pyramid. Eat less, exercise more.
Exactly.
Yeah.
They have no training in diet and nutrition, but they're medical doctors, so now they're going to teach us about diet and nutrition.
I want to emphasize Z-Pack because recently we've been talking about there is no one-size-fits-all diet.
Sure.
There's no one-size-fits-all approach. What I figured out was that for South Asians in particular, there's a certain phenotype or a genotype responds to a certain set of guidelines a little better.
This is the crux of their argument. They're saying to us here that your genotype and your phenotype and this type and that type, your blood type, they got the blood typing diet. All this makes a difference about how you respond to foods that you put into your body. Some people can handle fat better than others, saturated fat better than others. People in Asia can handle this kind of carbohydrate better than others. This is very true in the cooked world. But what they're not going to explore today is the raw world. They're going to talk about the vegan world and not eating meat, fish, eggs, or dairy, and that's going to be a little interesting. But this is how they think. This is the perspective they're coming from. They're coming from, we all cook our foods. Well, I don't cook my foods. My blood work is perfect. Now, if you want to try to account for that from some other way I'm getting it, I got no space alien story in my life. I haven't been abducted or anything, and I'm a raw foodist. I'm a vegan raw foodist. Those are my credentials.
And not leave it up to doctors who've been trained in a more mainstream Western fashion. Not to rag on my doctor colleague.
Oh, you can leave that to me. That's a carcass I'll pick over. Don't worry.
Recently, we got into a bunch of battles with the vegans. These guys are eating too much fat and too many processed foods,
right.
And that is what is triggering the diabetes, the high protein, high fat diet, the Western diet. Now, but that's not what you're seeing in Indian population.
Absolutely not. Properties. And there's been at least 6 to 7 studies that show that healthy sources of dairy fat will actually lower diabetes risk. And
I'm a small guy, like I'm 5'5". There is no one-size-fits-all. You have to experiment on the N of 1, the patient.
Absolutely.
Yeah. So the N of 1 is a type of clinical study where there's only one patient. There's not 1,700. I think like we saw from the doctor from What the Health, there's not 35,000, I think, which was done in the China study. No, there's one person. So what they're saying here is that every single person is different. We're going to categorize them into groups. We're going to say the Asians are like this, the Middle Eastern people are like this, physiologically. But there's something to be said here about blood types and this kind of stuff and where you come from, and you can have your genome run through 23andMe, or you can go to Ancestry.com and have that run, and it'll tell you a lot. But here's my thing. In the end, folks, We are all genetically identical.
You are at least 99.9% identical to anyone. Almost all your cells have about 6 billion base pairs that make up the genetic code that is expressed as you, meaning 5,994,000,000 of them are the same as anyone else.
It just flies in the face of what they're saying. But this is what the case is. We are 99.999% genetically identical to one another, even more than what this guy just said. We're the most genetically identical species on the planet. Now, the point is that I'm going to get at here, of course, is when we all move to the right diet, to the diet we really belong on as human beings, as really as any animal or any mammal, a diet of raw fruits and vegetables. You'll never get health, you can never get sick, you won't have diabetes. But you can play around with these numbers all day, every day, up and down, back and forth. The Japanese have this over here. The Chinese, but they don't do as well on this type of fat. But the Middle Easterners, well, they can't handle this, but these type of drive themselves crazy. That's why no one really gets to the crux of it, except yours truly, Dr. Bob, and all the other people that support this kind of a diet, which is the raw food, living food diet.
Yeah, I ended up subbing the coconut oil I was cooking eggs in the morning with olive oil, and I was still eating the eggs.
Yes.
Yes, you're still eating the eggs.
For lunch, I'd have sardines poured in olive oil with a bunch of Tabasco.
Beautiful.
Sardines with olive oil and Tabasco sauce on it. They're very, very common lunch.
LDL went from 165 down to 80 again. My
Look at
HDL
that.
stayed high, and
Awesome.
my triglycerides were still like 40.
Yeah.
So you have to experiment.
You have to experiment. Never, ever cook with coconut oil. Oh my God. I mean, he was using that to fry his eggs with. Eggs in coconut oil. And then he used olive oil. And his, triglycerides and all his HDL and all his bad cholesterol, all that stuff went down. Well, shocking. Let me tell you something. First of all, never cook with oil. How much do you learn about diet and nutrition in medical school again?
That's how many.
I use oil very sparingly. A lot of people, especially in the raw world, they want to use it all over the place. Extra virgin olive oil. I have maybe 2-3 teaspoons of extra virgin coconut oil every week. That's it. You're cooking it. Well, I don't cook, but that's about the stupidest thing you can do.
Is just take your triglyceride level, divide it by your HDL. We call that the triglyceride to HDL ratio, and aim for that ratio to be less than 3.0.
I want to do mine. Mine's actually not looking so bad.
To bring up also, you mentioned the ketogenic diet.
Yeah.
But I got to say that some of my patients, we see their C-reactive proteins actually go up as a result of the ketogenic diet back. So another example, because I think ketogenic diets are great, but I definitely in my clinic do see some side effects from that as well.
Side effects from a ketogenic diet. Okay. No one ever told me. I'm really upset right now, and I need to take a minute. I still love and accept myself, and
Some people like to pigeonhole me into some kind of ketogenic
Sure.
camp. I'm
Yeah.
not. I think that there's a lot of upside and downside to every kind of diet.
well, you didn't actually promote the ketogenic diet, but when you did that rebuttal of what the health, and you had the turkey jerky,
Found them in every single chicken sandwich.
it seemed like pretty much promoting the keto diet.
Yeah.
But you're not being a doctor. Why didn't you go to school? What are you doing?
right. Exactly.
Yes, everyone will start talking like Indians again. This is a lot of fun.
PCOS is basically, obesity, acne, facial hair. There are a lot of emotional stigma things. So a lot of girls that were teens that had this condition, they were teased by boys, they went through depression. So it's really a devastating condition, and much of it can be reversed with lifestyle changes. So I've seen some teenage girls or women in their early 20s, and we put them on the right sort of diet, and they're able to get off all their medications and reverse it completely. And they're able to get off all their medications and reverse it completely. And they're able to get off all their medications and reverse it completely. And they're able to get off all their medications and reverse it completely. They're able to conceive as well too. And enough, women are not told that this is actually a primarily lifestyle-induced condition that can be reversed with lifestyle.
How firm are you on that?
I'm pretty firm on that.
Well, here's another doctor who's going to disappear. I mean, you're going to find this guy in it. We got another milk carton victim. I mean, you don't say these things. His patients, they're coming in with this PCOS. He's changing their diet, and he's curing them. And how firm are you on that? I'm very firm. I mean, you cured him with your diet. Listen, radical. You need to knock this stuff off. This doesn't fly in the medical world. Have you ever heard of Dr. Sheila Carr? Okay, you know this woman? Yeah, she was around. She was well known. All of a sudden, No one's seen her.
Seen enough. You know, again, with any condition, diabetes, PCOS, insulin resistance is potentially reversible. It's more reversible than I'd ever thought.
Well, I guess he's learning that diseases are reversible. How about that? How about your body is capable of curing itself of any disease if you stop putting the wrong things into it and start putting the right things into it? Does that one fly there, doctors? You're learning.
I think there are some people,
Yeah.
exactly right.
Yeah.
Some people really struggle. They do everything right, and they still have this. And
No, as a matter of fact, they don't struggle to do everything right, and they still have trouble. And we had the commercial a while ago, you know, I was in perfect physical condition.
I'm a marathon runner in absolute perfect physical condition, and I had a heart attack right out of the clear blue.
People who are in perfect physical condition don't have heart attacks. People who do everything, they try to do everything the right way, and they just don't get healthy. That's not right. I guess what they're missing is they're not going to the right diet. Because you guys are sitting here with your blood types and your people types around the world and all this kind of stuff, and what you're saying is everybody's different. Everyone's its own N of one, its own study of one. I mean, no. We just need one study. Sorry, one. And the one study is you live on the diet that really nature lives on, raw fruits and vegetables, vegan diet, and you'll be incredibly healthy. That's the diet that you want to be on if you really expect to be healthy.
the answer is yes, in some cases, with the right approach for you.
Or the rest of humanity.
You see a typical patient in the office, you diagnose them with a thyroid TSH test, and you put them on Synthroid for the rest of their life.
Right.
You treat it as an irreversible condition.
Correct.
A lot of hypothyroidism is reversible. And because
Okay, I've heard about enough of the, reversible here and the, curing disease and this kind of stuff. Is it going to go? You're going to lose your licenses to begin with. They're going to come take them away. They've done it to other people. You don't talk like this. I kind of like you guys. I want to see you around. I don't want to see,
Lana Hicks says, every individual is their own study. Thank you for this. We'll be glad when more docs think this way and personalize treatments more. Everybody's an N of one. Everybody's their own study. And that's why, again, I get very upset when anyone tries to paint anything with one single.
And I get really upset hearing just the opposite. Weird.
By the way, that word sarcopenia, if you don't think I'm using that at the beach when I kick sand in some little skinny kid's face, you got to know. Hey, sarcopenia weenie. Look at those chicken legs. And I'm a small guy, like I'm 5'5". I'm a bully. I'm like a very short, very scared Vin Diesel.
If our medicine's you, I'd make a brain tumor look like a birthday present.
Okay, what's wrong with overcooking vegetables?
So the minute a vegetable loses its color and consistency, so basically you're going to lose a lot of the phytonutrient deficiency.
Cooking your food causes it to lose its nutritional value. That's a good one. No, I ain't falling for that one.
Do you guys see why I'd rather talk to Ron Sinha about nutrition than almost anybody from that movie, What the Hell? Because he is telling us there isn't a single answer for every single person.
See, what did you call that in your rebuttal to What the Health?
Hey, look! Confirmation bias.
Oh, yeah, that was it.
Confirmation bias.
What was it again?
Confirmation bias.
Okay, I got it. Confirmation bias. Yeah. What is it?
Confirmation bias.
What was it again?
Confirmation bias.
Confirmation bias. Got it. I got it.
And they're able to get off all their medications and reverse it completely. They're able to conceive as well, too. How many hours of nutrition training did you get in medical school or medical training?
That's how many.